Good morning, everybody. This is Liz Schote, registered dietitian and director of clinical nutrition here at Jackson Purchase Medical Center, doing another Learning with Liz lesson with you guys today. Well, it's March, almost the last day of March, but it's still March. And I know in the first part of this month I talked about that it was National Nutrition Month. Well, it's also National Colorectal Cancer Awareness Month also. So I thought today I would kind of talk about what that is, some of the statistics about it, and what we could do with our diet to help maybe with some prevention for it, because this is a topic that all of us need to know about, because anybody can develop colorectal cancer. So like I said, there are probably some things that we can do with our diet to help us out. So hopefully I can give you some helpful suggestions with that. So what is colorectal cancer? It's a disease of the colon or the rectum, which are parts of the digestive system. And it says, unlike most cancers, colorectal cancer is often preventable with screenings, and it's very highly treated when it's detected early. So most cases occur with ages 45 and above. So it may not happen with somebody that's younger, but I know in cases that it can happen with somebody who's younger than 45. So it's something we really need to be aware of. So it says each year about 150,000 Americans are diagnosed with this disease, and more than 50,000 people die from it. So if we can detect it early, then we can do some prevention and some treatment, and so that way the person doesn't end up that last statistic of dying. That's just not a wonderful thing at all. So some of the symptoms of colorectal cancer are things such as blood in our stool, persistent unusual bowel movements like constipation or diarrhea. Now there's a lot of irritable bowel syndrome that causes that also, but this is one of the symptoms of that. Stomach pains or aches or cramps that just don't go away, and losing weight for no reason. That's kind of the biggie thing is a person just starts losing weight and they can't figure out why they're doing that. So there are a few conditions that a person might have that increases their risk of developing this, such as inflammatory bowel disease or Crohn's disease or ulcerative colitis. Also, if you have a personal history of colorectal cancer or developing polyps in that colon, or it can be a genetic issue also. I can't even pronounce. I'm looking at the word on here, but it's a familial adenomatous polyposis. See, I can't even pronounce it, but that is something that's genetic. So it's very interesting of the statistics and things like that. So I want to kind of tell you about some of the statistics, and then what we need to do to help ourselves with that. So the average lifetime risk for men is 1 in 23, and for women it's 1 in 25. So think about it. I know you have 25 friends, and if you're a female, one person of those 25 friends may develop colorectal cancer. It's the fourth most common diagnosis of cancer in the U.S., and it's the second leading cause of cancer death in the United States. In the 2023 estimates of how many people that are going to be diagnosed with it is over 153,000 people will be diagnosed with colorectal cancer this year, and over 52,000 people will die from that. So and as I said, we usually say it's age 45 and over, but the age level is getting younger of when people are being diagnosed with it. So here's the statistics from 2007 through 2016. It says that rates for people age 65 or over dropped to 3.3%, but rates for people under 50 increased by 2%. So that's telling us that the younger the person is, the more chances of them to be diagnosed with it. With ethnicity, African Americans have the second highest incidence and mortality rate. From 2009 to 2013, colorectal cancer incidence rates were 20% higher for African Americans, and then the death rate is 35% higher for them. So, so what can we do? What can we do to help ourselves? Well, one thing is having a colonoscopy. It's not a great subject whatsoever. I myself was I don't need to have this done, but yeah, I finally did it. The recommendation was having it for people who are 50 and over to have a routine colonoscopy for screening. But guess what? Now it's age 45 and above. So we'll be showing you a picture of a bulletin board that we have here at the hospital, and it's a great bulletin board that our surgery department put up. But it says, if you were popular the year you were born, it's time to schedule a colonoscopy. 45 is the new 50, and it's showing pictures such as a new show, Laverne and Shirley, came out, and I mean, like I said, I remember that. And if you were born that year, it's time for you to have a colonoscopy. Garfield as a comic strip, the movie Grease. So a lot of these things are very, very, we remember these things. Well, guess what? It's time for you to have a colonoscopy if you aren't already presently doing that. So what can we do diet to help ourselves? So diet-wise is increasing our fiber intake. It's a very easy thing to do. Increasing our fiber intake, I say it's easy, but it also can be hard of trying to bump up our fiber intake. What is the average amount of fiber is anywhere from 25 to 30 grams in a day. I've read a few articles that say maybe even eating 50 grams of fiber in a day. Whew, that's really, really tough to do. But it is something that we can do to help ourselves. It's better if it comes from like a plant-based type of food. That's where we get that from. And there's many, many benefits for increasing our fiber. It can help us with keeping us thinking we're full when we're eating a higher fiber diet. We're not going to get as hungry because that fiber helps to fill us up. It also can help us with weight control. Many of those higher fiber foods are lower in calories, and so we reduce our calorie intake because, again, we're full from the extra fiber. Eating higher fiber actually helps to lower our cholesterol levels, as well as helping with a person's blood sugar if a person has diabetes. So there's many, many things that increasing fiber can help us out with. So what kind of foods have fiber? There's two types of fibers. There's insoluble and soluble fiber. So what the soluble fiber does is it attracts water and turns into a gel during digestion, and it actually helps to move things through that colon better. So these are foods such as oats, barley, nuts and seeds, peas, avocados, oranges, Brussels sprouts. Those types of foods have more of that soluble fiber in them. And then insoluble fiber helps the food to pass through a little bit quicker through our colon, so it doesn't set in there. And those are the foods such as apples, whole grains, whole wheat bread, whole wheat bran. So if you're wanting to increase your fiber say, well, I'm going to eat more whole wheat bread, fine, but read your label and make sure that the first ingredient listed is whole wheat flour and not white flour with, say, molasses added to it or brown food coloring to make it brown. So, looking at those labels, it's very important to read to see if it has that whole wheat flour in it for breads, rice, or not with rice, but cereals, things such as that. With rice, if we go more with a whole grain rice, it's going to have more fiber in that for us. So trying to bump up that fiber intake definitely can help us with many, many different things. But there's a very important thing, and I know I've mentioned this before, making sure that you increase your water intake if you increase your fiber intake, because if you don't, that could actually cause a person to have more constipation. So water's the very secret ingredient. So trying to bump up that fiber intake if you can. There's also fiber supplements that we can add to water, have little higher fiber biscuit type of things such as that can help us to bump up our fiber intake if we just can't get it all in with our food. So I hope today just gives you a little bit more information about colorectal cancer awareness. This is something that is very important that we all need to be aware of. And what can we do to help ourselves prevent from having that problem? So if you have any questions about today's lesson or have any ideas that you would like for us to discuss, please just drop us a little line here on our Facebook site, and we would be glad to cover that topic. So we hope everyone has a great day.